Good afternoon and happy Thanksgiving. I am thankful that I have family and health. I'm thankful that there are so many individuals who have dedicated their time and talents to service. I'm thankful to have an easygoing County Commission chairman who is here with us this afternoon. Thankful that there are good prospects for a vaccine. I'm thankful that in this era of panic and fear, we have a health director who is unflappable. So good to be with you again for the Joint Task Force briefing. We are working hard every day to slow the spread of the pandemic and respond to all the various needs that are connected to it during this very difficult time. For instance, the risk of losing your utilities or falling too far behind to catch up has been one of the terrible fallouts from the pandemic. That's why we have partnered with MLJW and the city of Memphis to put together a program to help, a program designed to hit right now during the holiday season. Our utility holiday program will provide utility assistance to hundreds and hundreds of families in Shelby County who previously told MLJW that they were facing hardship. Each family self-selected into the program offered through MLJW's Deferred Billing COVID-19 Assistance Plan. And on our end, Shelby County government set aside $258,000 to provide assistance. The assistance will be split among 1,400 families, and each of those 1,400 families will receive a $185 credit on their utility bill. For these 1,400 families, the assistance will just appear on their bill without any additional effort on their part. This is the last presser before the Thanksgiving holiday. We realize this has been a difficult time and that everyone needs to do everything they can to stay safe, but we must be determined to not let the pandemic steal our joy. We hope that the notice that these families will soon receive with respect to their utility bill will be a welcome holiday surprise. Additionally, we are always working to try to advance the number of tools that we have to slow the risk of the spread of this virus, particularly among vulnerable groups. And so one of the programs we have right now is responding to the need at the criminal justice complex, the Bailey Justice Complex at 201 Poplar, and to make further remarks about our response at that location, I'd like to invite to the podium at this time the Sheriff of Shelby County, Floyd Bonner. Again, happy Thanksgiving.
Thank you, Mayor Harris, and happy Thanksgiving to everyone. Shelby County government is leading an effort to improve the air quality inside 201 Poplar building and the jail confinement facilities. Mayor Harris and his team have contracted with a company that will install a system that should provide healthier environments for detainees as well as everyone else who works in or visits the courthouse or the detention facilities. Director Mike Deftrich of my staff will be working with county officials to install this system. How does this air purification system work? The county will install an electronic device that adds to the air ventilation system. We are told that it releases ions that travel through the air and attack and kill viruses, mold spores, and bacteria. The ions then steal away the hydrogen from the pathogens, leaving them to die and leaving behind clean and healthier indoor air. A company named Global Plasma Solutions, headquartered in Charlotte, North Carolina, has tested their product against the virus that causes COVID-19. And it says that its test results have shown that this product neutralization effectiveness was 99.4% in 30 minutes per test results. They tell us that the technology cleans the air the same way the air is cleaned outdoors in nature. The system generates the same ions that nature creates with lightning, waterfalls, and ocean waves. And with that being said, I will now introduce up to the podium County Commissioner Chair, Mr. Eddie Jones.
Thank you, Sheriff Bonner. I'm Chairman Eddie Jones, Chairman of the Board of Commissioners. I want to thank Mayor Harris, Sheriff Bonner, for engaging with the County Commission as we provide air quality within our buildings. One of the things that we looked at when looking at this was to ensure that our employees would be safe, and the thousands of people, our citizens in Shelby County, who enter into our buildings. This is just the first of mitigation and to make our buildings safe going through this pandemic, this crisis, and always putting our citizens first on the front line, as well as our employees, as we continue to mitigate this coronavirus. And with that being said, I think, am I supposed to bring up Chief McGowen? Chief McGowen.
Thanks, Commissioner. Glad to be with you all today, and I'll express my happy Thanksgiving greetings to everybody as well. Talk about three things today: the time leading up to Thanksgiving, the Thanksgiving holiday, and right after. So leading up to Thanksgiving, we asked all of you to take every action that you possibly could to keep yourself safe. That included getting tested to know your status. This past weekend, we had a big asymptomatic testing push, and nearly 3,000 of you took advantage of that testing. We're very thankful for our partners at Poplar and AEL and our healthcare providers who participated in allowing us to get that job done. The important message from that was that almost 250 people came back positive. That's a 9% positivity rate amongst people who believed that they were not ill. In other words, they didn't have any symptoms. And so that's a pretty high positivity rate, indicative of what's happening in our community. And I offer that so that for all of you who are out there who believe that you are okay and who do not yet know your status, it's important for you to get tested to know your status, because 1 in 10 people who came this weekend believed the same thing but turned out to be positive. As we go into Thanksgiving, we want to reemphasize the fact that it's important, as we care for each other, that we gather only in small groups of people with whom you live. If you intend to gather with people that do not live with you, I encourage all of you to know your status. And don't gather with anybody who does not know for sure that they are COVID negative. There's still time. We have testing going on today, and if you get your test by the end of today, you will know by Thursday morning whether or not you are negative. So please, do the right thing, know your status, limit your gatherings to very small groups, and my family will be wearing masks and gathering outside. It's supposed to be a beautiful day on Thanksgiving, 60+ degrees. Be outside, social distance, wear a mask, and don't get together unless you know what your status is. Following Thanksgiving, we know that there will be people, though they've taken every precaution necessary, will somehow contract the COVID virus, and they will be symptomatic. Though you will have been off work for a few days and you're anxious to get back to work, if you are feeling ill, do not go to work. Do not go to school. Do not go to the grocery store. Do not socialize with your friends if you are symptomatic. Instead, go get a test, isolate yourself until you get those results, and please do what you can to prevent the spread of COVID-19 to your friends, family, and coworkers. The success of our asymptomatic testing will be continued after Thanksgiving, because we know going into Christmas there will be yet another surge. And so I want to remind everybody that we have more than 12,000 tests a week that we have just available to the public. That's not through your private provider. And so every single day of the week, you can go get tested. We will be giving additional information about the surge, but it's free, it's easy, and it's convenient. Please go get tested even after the Thanksgiving and moving into the Christmas holidays, and look for more information coming from us. It's incredibly important that we take these actions now so that we don't have a problem into the new year. With that, I'll take a pause and I'll introduce Dr. Haushalter, who will give us some data on the pandemic today.
Good afternoon, everyone. I also want to extend my greetings for the Thanksgiving holiday. I'm going to give brief data updates, highlight a few things from the new health directive, and Dr. Randolph will join me. He'll talk in more detail about the health directive, and then we also want to give an update on vaccines and the availability of vaccine in Shelby County in December. As was noted, this is a challenging time. We've continued to see high rates of positivity, not just amongst those who have tested for the first time, but as was pointed out, those who had no symptoms whatsoever. We do know we have widespread community spread. We want to continue to give updates so people can make sound decisions about their activities and things that they do to reduce ongoing transmission. As of this morning, we had 45,952 cases. That's an increase of 377. We've been running approximately 340 cases per day on average for 7 days as well as 14 days. So that's staying steady at the current time. We have reported at this point 637 deaths in Shelby County. We do know also that our positivity rate continues to run above 1.2, actually closer to 1.3, and our duplication rate is still around 40 to 42 days. We do anticipate that there will be a potential for a surge at the holiday season, so I do ask that you heed the instructions that were given by Chief McGowen to know what your test status is ahead of time, but also to make sure that you keep your gatherings small, ideally to less than 10, and ideally just your own household, but if you include others in the household, only include one other household. But you should continue to mask, social distance, and wash hands in addition to the other things that we've noted. We've had some questions about the health directive, so there's a few things that I wanted to clarify. There's some key areas where we've given recommendations. One is that for places of worship, we've recommended virtual worship. That's been a consistent communication that we've had, but we're stressing that more now that we have a surge. We also encourage schools to take a pause for extracurricular activities. Again, during the surge, we know that transmission in the schools has been associated with extracurricular activities. We've also made recommendations for households based on what was shared earlier and the size of gatherings. We have reissued our mask directive, so that's Mask Directive 3. And most of the items in there are clarification. So it is not a new directive to wear a mask while in a gym. That has been the directive all along. However, we continue to receive complaints that people were not masking within gyms. And we do know that gyms are a high-risk setting because they are indoors. People are exhaling more deeply than they typically would because of exercise, which increases transmission. Then we've placed some restrictions on restaurants, and that's in limiting hours to 10 o'clock, limiting to the capacity within to 50%, and limiting the number of people at a table to 6 for adults and 2 children. Those, in our opinion, are the least restrictive actions that we can take at the current time, and the goal is to reduce ongoing transmission prior to going into the traditional Christmas holiday season. So I'm going to end there. Dr. Randolph will give more detail on the health directive and a little bit of an update on vaccines. Thank you.
Thank you, Dr. Haushalter. Greetings, fellow citizens of Shelby County. I'm Dr. Bruce Randolph, the health officer for Shelby County. Dr. Haushalter has covered most of the major changes in the health directive that we issued on Friday that became effective Monday, November 23rd. I just want to highlight another area, and that is enforcement. In order for us to be successful in this health directive, we really need everyone to comply and to follow this for your safety and your health that we issue these directives. And so I want to remind businesses that if you found to be in violation of the health directive that you will be closed automatically for a minimal of 14 days, after which you would have to provide a corrective plan that we would review to see how you would go about correcting the violations that you are found to be guilty of. The other thing, too, in addition to closure, you could potentially risk being cited up to $2,500 for a violation of the health directive as a misdemeanor, and you could be at the risk of losing your liquor license or beer permit. So we're really asking that everyone comply. And the reason why we're having to take these measures is because when we allowed businesses to operate even to 12, there were reports of multiple violations, people not adhering to the social distancing or wearing the mask, or staying open later than the designated time. Curfew is at 10. We're going to ask law enforcement, sheriff, and municipality police officers to assist us in enforcing this curfew. And so we're asking that if the officers see a facility that should be closed at 10, not closed, that they would intervene and close it if permitted. The other thing I want to just touch on is the vaccine. So we've been informed by the Tennessee Department of Health that we should anticipate receiving the vaccine sometime after December the 15th. A plan has been implemented that's preliminary, but the plan goes as this. Those who would receive the vaccine would be prioritized, primarily one looking at healthcare workers who are at high exposure in hospitals taking care of COVID-positive patients, then also first responders and other healthcare staff members, hospitals, long-term care facilities, assisted living facilities, etc. Shelby County is slated to receive approximately 33,000 doses of vaccine, in which Shelby County Health Department will receive 22,425 doses. Baptist received 1,950 doses. Labana 1,460. Methodist Germantown 1,220. Methodist University 2,190. Methodist North 730. And St. Jude's 3,400 doses. Other healthcare systems have applied and are in the process of being processed, and they too will receive doses of vaccine that would be administered. I would just say that our goal with vaccination is to try to obtain at least 70% uptake, and therefore the state is providing that amount of coverage to cover people. With that, I will stop and entertain specific questions you may have pertaining to the health directive and the vaccination or anything else that was presented today.
Sam Hardiman with the Commercial Appeal.
Hi, Dr. Randolph or Dr. Haushalter. What enforcement has occurred so far of the latest health directive? And then I have a follow-up.
Of the health directive that was issued on Friday and became effective Monday, to my knowledge, we have not taken any enforcement efforts. Our approach is to provide education, technical assistance, give people time to know what is expected. We will actually come on site in some instances to provide that technical assistance. Once we've done that and you are in found to be not in compliance, then we would take the other enforcement actions.
And my follow-up is, if cases continue to rise and continue to see the rate of growth and hospitalizations continue to see the rate of growth they have in recent weeks, should we expect the health department and mayors to consider more restrictions ahead of Christmas?
Well, I would encourage people to pay attention to the health directive, because in the health directive, there are some criteria, trigger wires that is in place that we will follow and adhere to as we monitor the data. I really can't say what will be the actions taken around Christmas. We'll have to see what the data shows.
Brad Broders with Local Memphis 24.
Thanks. Good afternoon. My first question is to Dr. Haushalter. What concern do you have in the coming days and weeks about people leaving bars and restaurants at 10 and then maybe going to maskless house gatherings and the potential spread there, and your message to the public about that? And I have a follow-up.
Thank you. My general message is that while we have many things in place, not just the restrictions that we've noted, there's quite a bit of effort put into communication, case finding, which is all of the testing efforts, and contact tracing. We do have to urge people to take some personal responsibility. So as individuals leave a facility at 10 o'clock and go visit friends or socialize with others, they really should continue to mask and should continue to social distance. And if they have any signs and symptoms of illness, they should stay home and not participate. So I really encourage people to consider the impact of their personal choice on others. I've heard a lot in the last day about personal choice, and I fundamentally believe in personal choice. But if I make a choice that puts others at risk, it changes the equation. So I encourage people to really think about that when they go visit others and choose not to wear a mask. And your follow-up?
Thanks, Dr. Haushalter. I've spoken with some business owners and restaurant owners. They say they're following the rules. They're concerned the health department isn't giving them clarity about how to be put in all the safeguards. If you could just talk about just your response to businesses concerned about surviving and as you're making decisions about balancing public health and economic health.
It is a very difficult balancing act. I empathize with anyone who's impacted by COVID. The businesses clearly, but not limited to the businesses, those who have lost loved ones, clearly those who are not able to visit individuals in nursing homes. That's a great example of where there's a perception that the health department has limited those visitations. We have not, but I know people who can't visit others, and so I do empathize with those individuals. It is a balancing act. We have to not only balance what's happening today, but we have to look forward and project what the impact is going to be in weeks to come. And our current forecast is that the Christmas holiday, specifically on the December 25th day, we anticipate well over 500 people being hospitalized. Our systems are strained to capacity, and so these are difficult decisions. They're not made in isolation. As a health department, we seek input from our colleagues within the Joint Task Force, from the mayors, Mayor Harris, as well as Mayor Strickland and the municipal mayors, as well as our colleagues in healthcare systems. We also look at what's happening across the rest of the United States and the rest of Tennessee so that we can try to make the most informed decision that we can. But again, these are very difficult decisions, and we recognize that.
Kendall Downing, WMC TV.
Hey everyone, good afternoon. I know you kind of mentioned this, but could you further clarify? We found a lot of gyms that had reached out and sent messaging to members or reached out to us under the impression that the masking was a change in the directive, and it seems like it's some messaging that you all are wanting to get more out there that needs to be done. Could you clarify, if that is the case, and were you receiving complaints about masks not being worn in gym facilities? And I have another question. Thank you.
Yes. So yes, we were receiving complaints that people were not masking in gym facilities. That was including employees as well as those who were working out. We have required masks in gyms for the employees and the patrons for some time. So we believe that moving to better clarity in the language would reinforce that people should wear masks while they're in gyms. It's a high-risk setting. In part, it's indoors. Again, people exhale more heavily, and so that puts people at risk. I also want to add a few other data pieces. Chief McGowen mentioned that of the asymptomatic testing that occurred this weekend, over 9% of the people that were positive and they had no symptoms. We also know for individuals who are symptomatic, over half of those individuals continue to go into public places when they are symptomatic, and that includes gyms, restaurants, and so on. So that's the information that we've used to inform, one, our communications, as well as any further restrictions we have. So we really did want to, with gyms, reinforce the need for masking because it was a high-risk environment. And your follow-up?
Yes. My follow-up is, across the country, there's been a phenomenon of health officials taking a lot of heat for all of these restrictions. And I know that this has been going on for months and months and months. Could you talk about how challenging it's been for you all to face the public pressure and in some ways, some of the comments, I know you mentioned last night at the commission meeting, the comments that have been directed toward officials, and how it's been to work through that process? Thank you.
Thank you. That's a good question. We may not have enough time today to cover all of that. I would say this is actually a national phenomenon. It's not just Shelby County. As a nurse, I know during crisis you see the best of people and the worst of people. When people are under extreme pressure and experience anxiety or other emotional stress, they tend to act that out. So I do appreciate that when people say things that may be personally offensive or offensive to other professionals. I do know there's a lot of misinformation. I listened very attentively to those who spoke yesterday evening. I listened to it again this morning. I do want to hear what people have to say. I do want to understand people's perspective. But I also know that some of the information is not accurate information. So it challenges me and the rest of our team and the Joint Task Force to be as clear as we can about decisions that we're making, how we make those decisions, and how we're informed to make those decisions. But I know that nationwide, the last conversation I had with NACHO, the National Association of City and County Health Officials, we've had over 90 health officials resign in the United States, one because of the pressure that they're receiving for their position, but also threats and other things that really are, as I would view it, less than kind. And so I do know that there's significant impact there. I also know at the national level, there's a push for legislation that provides some level of security and support for health officials specifically who have been threatened either by the public or others. Thank you.
Jacob Seimer with the Memphis Business Journal.
Yeah, thanks for taking the time. You mentioned, I think you said that you're predicting by Christmas 550 people in the hospital.
I said well over 500. Right? Well over 500. Mm-hmm. And that prediction changed over 500. The prediction will change day to day based on the data, and we report that within the Joint Task Force on a regular basis.
Can you kind of let us know what that would look like in the hospitals? I know that they're about out of nurses as it is.
So I think to some degree you've gotten to the answer. It's going to be a challenge for our healthcare systems. There are insufficient nursing resources across the United States. It's impacting us greatly. We know that nurses are again leaving Shelby County to go to other communities because they're being offered significant amounts of money to be able to do that. The Joint Task Force is working closely with the hospital systems to consider all the ways that we might be able to locally help the hospitals, particularly with staffing. It impacts elective procedures, and I think oftentimes people think of elective procedures as things that you can put off. But if someone needs a hip replacement because they're in pain, they don't want that procedure put off. And so it's going to impact all of those things, which is why we're really focused on reducing community transmission at the current time so that we can alleviate some of that pressure on the healthcare systems.
Jane Roberts with the Daily Memphian.
Could you tell me what the responsibility is of the restaurant owners if people from different households are sitting together at a table? Who's supposed to monitor that?
So we don't believe that the restaurants can police if it's one household at the table or not. One, we are requiring that there be no more than 6 people at a table, 4 adults and 2 children. If it's adults only, it needs to be the smaller group of 4. We are recommending that it be a household. Clearly, by focusing on staying in one's bubble, as you hear at the national level, you reduce the number of people who might be exposed if you have COVID and the number of people who might expose you to COVID. So we don't anticipate that the restaurateurs can do that. If a group presents itself as a household, they have to make an assumption that that group is a household. And you follow up?
No follow-up at this time. This concludes all questions in the queue. Any closing statements?
Just want to wish everyone a safe and healthy holiday. Thank you.
Thank you very much, everyone. This concludes today's daily press briefing. Have a safe and enjoyable holiday, and we will see you next time.